For our showcase presentation, we chose the topic of educating undergraduate nursing students on the consequences of shift work. This is being presented by Journey Bond and Candace Sharp. We chose this topic to educate undergraduate nursing students on the effects of shift work has on one's health and work performance. We want students to be able to identify interventions they can implement to prevent these effects from happening. A few effects we are focusing on are long-term health effects, patient and occupational safety, prevention and reduction of medical errors, and quality of improvement. Our PICO question is, in undergraduate nursing students, what is the effect of an educational session on their level of knowledge on the consequences of shift work on one's health and work performance? Shift work is usually defined as alternating shifts, also known as flex shifts. This is when you are hired into a position where you could either work days or nights, and each institution has their own definition of alternating shifts. For example, at one facility, you could work day shift for a month and night shift for the next, while at another facility, you might be able to choose when you want to alternate your schedule. And shifts usually range from 6 to 12 hours, but nurses in the inpatient setting usually work 12-hour shifts. So for our literature search, we used the databases Medline, CINAHL, and Scopus, and a couple keywords we used were shift work, mental health, burnout, nursing students, and patient safety, and the data range of the article we used were 2011 to 2021. So for some background evidence, on average, nurses get around 4 hours less of sleep when they work night shift. And research also found that anywhere from 26 to 50% of night shift workers report severely reduced alertness, decreased sleep, excessive fatigue, or long-term insomnia.
Our capstone group decided to develop a PowerPoint to facilitate our teaching sessions. In that session, it included information of how shift work can affect one's health and work performance and strategies on how to minimize and prevent these effects. It was presented to 35 undergraduate nursing students during their learning community course, and we provided a 10-question pre- and post-test to assess their knowledge prior to and after the session. We gathered our results through the utilization of a Likert scale for the first 6 questions. We had students report on a scale of 1 to 5 their level of agreement with the following statements, 1 being strongly disagree and 5 being strongly agree. As shown on the table, there was a significant increase in the knowledge or understanding of the impacts of shift work and interventions used to minimize those effects. The last 4 questions were multiple choice. Students received 1 point for each correct answer. Here we can also see a significant increase in results from the pre-test to the post-test to indicate successful teaching and comprehension of the information. We also came up with a short list of recommendations for consideration, one being that undergraduate nursing students should be educated on the effects of shift work and how that impacts one's health and work performance. Why? Because as new graduate nursing students, it's likely to be offered and oriented into working night shifts or rotating shifts. There are multiple factors that influence graduate nurses to accept those positions and make the night shift seem more favorable. However, we cannot always foresee the long-term effects of shift work without awareness or proper education. Undergraduate nursing students should be provided with strategies that could help minimize the effects of shift work inside and outside of a clinical setting. Further research should be done to help determine the most effective way to present this topic to undergraduate nursing students as well. In conclusion, nursing is a demanding profession that requires around-the-clock care to ensure patient safety. It is important that undergraduate nursing students should be educated on the effects of shift work on one's health and work performance and how to minimize that. During our teaching session, we highlight the specific impacts and interventions, which in turn, as shown in our results, our teaching was effective and there was a reported increase in the level of knowledge on this topic. Here are our references, and thank you for watching.